Deputy Speaker.
Order.
Notice of motion, item 1, supporting healthcare, a motion standing in the name of Dr. Tan Yia Swam.
Dr. Tan Yia Swam.
Madam, I beg to move that this House commits to supporting healthcare beyond the COVID-19 pandemic and the whole of government efforts for consistent and sustainable support. I declare my interest as a breast surgeon in private practice and my various medical leadership roles as an appointed member of the Singapore Medical Council and the Vice President of the Singapore Medical Association. More importantly, I speak as a daughter to elderly parents and parents-in-law, as a mother to children with medical conditions. Allow me to say a few words in Mandarin. 有句话说，医者父母心，意思就是医生应有为人父母之心。医生对病人有一种很牵挂、很担心的心态，就如父母对孩子的心态一样。医生应该一辈子带着这种心态。可惜的是，病人未必愿意一辈子当他的小孩。孩子小时不懂事，凡事都听父母的吩咐。当孩子慢慢的长大，开始叛逆。便会开始反抗家长的指示。30年前，一般的病人都会聆听医生的话，但现在由于科技发达，容易获取信息，越来越多的病人也会质疑医生的判断或指示，甚至给予挑战。Why does anyone stand up to advocate for certain causes? We want to leave behind a better world than what we were born in. I advocate for the doctor-patient relationship. As a patient, I want my doctor to look after my best interests and not be worried about being complained or sued unfairly. As a doctor, I want to focus on my patient's medical conditions, her needs and wants. But life is more complicated than that. So many other factors influence this relationship. Different kinds of health-seeking behaviors, different health beliefs, financing models, expectations of outcomes, customer service, social media marketing. Business entities seeking to profit in the healthcare sector. Why am I pushing for a whole-of-government effort? Healthcare spending is the second highest in the national budget, with emphasis on building more hospitals, polyclinics, healthier SG, and recruiting staff. This cannot go on indefinitely. But the current hot news is now about the cancer drug list. I share a list of sobering health statistics. Yearly, 26% of deaths are due to cancer. Yearly, 20% of deaths are due to pneumonia. Every day, 20 people die from heart attacks or strokes. Every day, 4 people undergo leg amputations due to diabetes. Singapore ranks first in the world for diabetes-induced kidney failure. 1 in 10 people over 60 years old have dementia. 1 in 10 people have a mental illness. 1/3 of postmenopausal women have osteoporosis. And if they ever have a hip fracture, 1 in 5 will die within the year. These are some well-known facts in our medical community. Health news magazines frequently report these. But people don't care until it happens to them. Most people have a healthcare encounter only when they are sick, and that's too late. Humans have short memories. That's why the institution has to remember and pass on the teaching. It feels like the whole country, even the whole world, has moved on after COVID-19. But if you look back at the history of pandemics, the next one will be here. Maybe in 10 years, maybe in 5. We need to be ready for the next pandemic, for the super tsunami, for mental health crisis. Healthcare must be a global, national, whole-of-government effort and not only Ministry of Health. I urge for all of you to adopt mindset change. I urge every ministry, every government official, every public servant, in fact, anyone listening right now, to think in terms of how to better teach our people to look after their health and prevent illness. Next, support for healthcare workers. What does it mean? It cannot be just a one-time snapshot. It's not a once-off wellness event, a thank you campaign, a medal. Regular salary revisions to match inflation and rising cost of living are essential. But beyond that, support for healthcare workers should be a deeply rooted respect and acknowledgement of the nature of our work. Many of us see our work as a calling. We commit to looking after patients. It is more than just a job. Much like our armed forces who protect our nation, healthcare workers protect the health and well-being of our people, not just business transactions selling remedies. What kind of support do healthcare workers want then? Back to my analogy about the parent-child relationship. I hope the doctor-parent relationship will be mutually loving and respectful. We cannot be just using that one day on Father or Mother's Day to love our parents, right? It should be an ongoing process. Take into account what we say, listen, and involve us in decision-making. I've explained why we need to support healthcare beyond the pandemic and why we need a whole-of-government effort. I now share 3 broad strategies on how this can be done. 1, identify and acknowledge problems. 2, education at all levels. And 3, cross-collaboration. Let me tell you a funny story. More than a decade ago, as a junior doctor, I remember there was one day when there was a mini commotion in the operating theatre. We were told to recall our chits so that the queue of patients waiting for surgery is cleared up. I demanded to know why, and I was told, Minister is visiting. I remember being indignant and told the sister in charge, let him see how swamped we are. Of course, I was chased away while the welcoming party walk came around. Yeah, I was an angry young doctor, but I resolved to learn to be a better advocate for change. Leaders need to walk the ground, and healthcare workers need to learn to speak up better for ourselves. Maybe it's not in our nature to ever admit defeat or ask for help, because it implies weakness, and we are determined to stay strong for our patients. And maybe that's why so many of us work until breaking point. In the past 2 years, mainstream news and social media gave much attention to bed shortages, long working hours of junior doctors and nurses, bullying and harassment, but I tell you, this is nothing new to us. Corridor beds, lodges in tentage, conversion of day surgery bed to acute care beds. Once, another story went on call, I was called by HOD in the middle of the night to urgently identify patients who were discharged in the morning because there were 50 over patients waiting for a bed in the emergency department. So there were patients fit for discharge, but the common social request was to keep the patient until the weekend because the children cannot take leave to bring him home or to wait until the helper arrives in Singapore. So instead of operating, I was there doing bed management and being scolded by family members for being heartless. Then when I go down to finally attend to the new patients waiting, I get scolded for making them wait very long. A call starts at 8 a.m. and ends at 8 a.m. the next day, followed by a full day's work until 6 p.m. the following day. We did 6 to 8 calls a month. 80 to 100 work week hours were not unusual. Doctors, nurses, lab technicians, couriers, healthcare attendants, everyone in the healthcare system is trying our best to meet demands, and sometimes we cannot deliver. How many of us have just gone to cry and hide the toilet for a while, and how many have walked away? We have seen the ups and downs of problems in the past decades. Removal of guideline of fees coupled with charge plans leading to escalating costs due to multiple factors that we are still trying to address now in the MHIC. Changes to residency training leading to loss of mentorship, loss of sense of belonging by the trainees, shorter training periods with consequences in some specialties. Privatization and commercialization of healthcare is a necessary evil. Someone has to ensure there is money to run a sustainable business. But when healthcare workers are treated as a commodity by administrators, it's yet another bad influence on the doctor-patient relationship. Currently, we face new concerns. In the private sector, business costs are increasing due to rental, manpower costs, and pressure from business entities. Perpetual problems with poor IT systems, brain drain of experienced nurses, allied health, and even doctors. I have previously spoken of wellness and alternative health services, which are not regulated and which sometimes do more harm than good. Poor use of Google, leading to badly written SEO articles that further increases the disconnect between doctors and patients. Some family physicians have expressed their perceived difficulties to onboard Healthier SG. Many doctors are concerned over the capitation model about impact of drug whitelists and actual payments to GPs, which may not cover their running costs. Now, I'm not saying it's bad. I'm saying doctors are worried about these changes. We have lived through changes with adverse outcomes, and we feel really helpless when others dictate how we should practice medicine. We should learn from the mistakes of the past so that we don't repeat it, but humans have short memories, and few people have the time or commitment to dig into history. Political office bearers come and go, but for most doctors and nurses, we are here for a lifetime. The longest-serving Minister of Health is Mr. Gan Kim Yong for 10 years, and for that, I thank him for the warm and supportive relationship he had with our profession, which Mr. Ong Ye Kung has kindly continued, hopefully for the future after my speech. There is no one who is giving the healthcare system his full attention and thought. Doctors do clinical work, clinicians, scientists do research, nurses care for patients' daily needs. Many feel unease and unhappiness at the system, but there's no one whose job is to really evaluate the system and improve it. Instead, experts from other service industries are imported to provide opinions, get paid consultancy fees, and they leave, while we care so hard, so badly, that it hurts. Even with all my lobbying for the private sector, for reviews into shield plans, corporate insurance, concept services, third-party administrators, many have heard but might not be listening. Sadly, even my own doctors do not pay close attention to my advocacy efforts and keep repeating the same old grouses. Some are aware but don't dare to take action. They might be afraid of losing their livelihoods if they don't play by the rules of TPAs who have come between doctors and patients. I frequently said to my peers, it is common sense that a business should be profitable, but we should never profiteer from people's suffering. Healthcare providers are in a no-win situation, getting complaints for long waiting times in government hospitals, getting accused of overcharging in private. Patients have very high expectations now. We all want perfection, cheap, fast, and good. I have repeatedly vouched for our restructured hospitals. We all train and work there at some point, and they provide good quality care. Sometimes the communications may not be as clear or personable, simply because it's a very large team-based practice. I think restructured hospitals are cheap and good, and then hard to be fast. I ask the public to be understanding. The restructured hospitals are teaching hospitals. We all start somewhere. We all learn through mentorship by examining small arms, do our first operations. Patients are never used as an experiment. There is consultant-led practice, and there is a specialist in charge of your medical journey. When you meet a young doctor with a heart, I hope you help that doctor to train and grow. Some of you will choose to go private if you can afford it, because you get personal service, it is generally faster, there's more privacy, because it is a much smaller team attending to you. But then I ask for your understanding that every doctor runs a business, and there are various models that are used with business, with various different business costs. If you find a doctor that you trust, and there's clear communication and transparency, I hope you'll also give him the support he needs. I have listed a string of perennial problems, which are complex systemic problems, and I don't expect any one person to solve. Stay with me as I share my views on education and cross-collaboration. There are many ways how people learn. I think the commonest method is by frequent exposure and repetition. We eat frequently, right? 3 times a day, maybe 5 times or even more. Singaporeans are passionate about our food. So if I ask about chicken rice, there will be a very hot-blooded, robust debate on which store is the best, comparing roast chicken versus steamed chicken, the ginger, the chili. Enthusiasts will even know the exact cost breakdown from different stores, how much is charged for extra chili, extra rice, or upgrade to the Thai meat. But how many of us need major surgery or admission for major illness? There are some patients with complex medical issues who will be in and out of hospitals, and the healthcare team ends up knowing the patients and families very well over time. Such families will likely also be very aware of how treatment costs are like. For most people though, the first major illness is the first time ever we have to seek medical care in the hospital. That's not a good time to find out how expensive healthcare is. One is already worried about cancer diagnosis and impact on survival, side effects and potential complications of treatment, responsibilities of work versus family. Not many people know the cost of treatments in Singapore, and many are stunned when they first see the numbers. I know I was when I had to handle the bills for open heart surgery. Healthcare financing is very complex, and there are actually many safety nets for Singaporeans. Public sector versus private sector. Who pays? Taxpayers' monies, insurance pooling. Various combinations of co-payments and tiers of subsidies exist. The problem is most healthy people don't bother to check these until they encounter a health issue. If it's an elective surgery, there's time for financial counseling, pre-authorization, etc. But in an emergency, the team will deliver the necessary life-threatening treatments first. Then the patient and family may be saddled with a big debt, or the hospital writes off a bad debt. Not often, I believe, but I know that this happens when we have a foreign worker with no health insurance, just an accident policy, and there's no or inadequate cover. Same for locals who are not familiar with the product they bought, whether it's a plan for hospitalization, critical illness or early cancer plan, or maybe they did not know about exclusion terms or coverage limits. I pick up this lingo and knowledge only in these recent 3 years, and I hate it that I have to know it. It distracts from my real work in caring for patients, but it is necessary. This is what I talk about in March, for insurers to build closer working relationships with healthcare providers so that patients have more assurance of affordability. People need to learn how to navigate our healthcare system. Some years ago, I started a blog specifically on how to enter the healthcare system, the different paths available and the pros and cons of each. But I couldn't maintain it. Other commitments took priority. Since then, I've seen several well-written articles. There's no need to keep reinventing the wheel. Collect these, have a good library of such articles in a central repository, and let it be the main reference for all Singaporeans. People don't actively care until it happens to them. Look at global warming. Does the average person worry about global warming even when faced with evidence of changing microclimates? Does a person worry about fertility and starting a family young until they're actually trying and come across difficulty? I know most of my patients never worry about breast cancer until they have a symptom or heard that a friend or colleague is recently diagnosed with breast cancer. Then it triggers fear and worry. People care only when things affect them. I want my children to grow up and take responsibility for themselves. Likewise, I believe that every one of us can take responsibility for our own health, but we need to be empowered on how to do this. Humans are emotional creatures, but we have the capacity to think. Learning how to regulate emotions and using our brains to think is an invaluable skill that can be taught from young childhood. I know some adults who still struggle with this. I cannot underestimate the importance of having a scientific and logical framework in approach to all problems. Fear, anger, worry, joy are all emotional responses that are normal, but we must learn to regulate them. Too often, I see my patients paralyzed by anxiety that interferes with the treatment process. Some diseases are well studied and the progression is clearly understood. Example, hepatitis B leads to liver cancer, and hepatitis B vaccination is effective. Some others are multifactorial, such as most cancers and cardiovascular disease. So just because I smoke, it doesn't mean I will get lung cancer for sure. Likewise, just because I don't smoke, it doesn't mean I will never get lung cancer. It's not so simple. There's no magic bullet or 免死金牌. Obesity, strokes, heart attacks, we call these lifestyle diseases because every day we make small decisions on food and activity level that will build up to or prevent these. Some illnesses are insidious. Do we recognize mental health issues, or is it unseen until there is a sentinel event with self-harm? Preventable trauma is another huge area we can improve on. Awareness on child safety seats, road safety awareness by all users, including pedestrians and cyclists, stricter regulations for driving licenses, giving way to emergency vehicles, workplace safety. There is so much to teach, so much to learn. Education cannot be assigned to just MOE, just as health should not be the domain of MOH only. I firmly believe that education starting from as young as infancy and carry on throughout our schooling and working adult years will be the key to good, sustainable health. I'm glad that Mr. Ong stated last month that MOH will partner MOE and MSF to lay a strong foundation of health for our young. I am alarmed at how often I notice infants being spoon-fed while they're looking at the iPad. Studies have shown that screen time adversely affects brain development. Babies are not able to read faces as well and develop social skills, leading to later problems in executive and higher order functioning, such as the ability to focus, impulse control, and emotional regulation. I have seen increasing numbers of young adult patients in their 20s with such problems, and I'm deeply concerned for the future generations. Teaching the appropriate use of technology is not just for the young, but for the adults as well. News abound of increasingly elaborate financial scams in relation to health. There are trends of miracle cures to fight cancer or guarantee weight loss. I've seen patients trying black garlic diet, aloe vera, alkaline water, negative ion clothing. The list is endless. I call this pseudoscience because there is a hint of truth in it. There is one experiment to show that the item has one property that has killed a few cancer cells in a petri dish. To me, this is like an observation that, hey, the ant can use a leaf to float on water. Therefore, if I use a big leaf, I can use it to sail across the ocean. I cannot professionally extrapolate such studies to claim it can cure cancer, which is what the salespeople do. And vulnerable patients will try it and sometimes forego proven treatments. During the pandemic, vaccine hesitancy and big pharma conspiracies had direct negative impacts on public health. Internet connectivity has brought people closer together, but has also allowed misinformation to flourish. People rely on word-of-mouth recommendations. Some use Google reviews, and some people do not know that these can be bought or fake, or that there are malicious marketing agencies who deliberately downvote rival companies. Whose role is it then to teach people how to use Google and AI as a tool? It doesn't feel like it should be the government's job. It's up to individuals then. Motivational speaker Jim Rohn said that you are the average of the 5 people you spend the most time with. I use this to take stock of my personal and professional growth periodically. Whenever I feel stagnant, time to review and change a bit. Step out of your comfort zone, learn something new. Don't settle in too comfortably and be trapped in an echo chamber. Lifelong learning is a challenge. How do we then cultivate this mindset in people? This leads me next to my next point, cross-collaboration. I think the COVID-19 Multi-Ministry Task Force was a good platform for leadership to discuss and share timely info on a rapidly evolving situation and align policy direction. Of course, there were problems as it filtered down because humans being humans, we have a wide range of responses. We had people ranging from lawful good to chaotic evil, to use a Dungeons and Dragons reference. Some followed the exact letter of the law. Some followed the spirit of what is intended. Some profited off others' desperations. And some willfully, selfishly live by their own rules and not respect the society they are living in. The government of Singapore is complex, organized to 16 ministries, further divided into departments, divisions, and more than 50 step boards. Do people from different ministries talk to each other, or is there a very strict protocol of how new ideas can be raised? I ask because previously, when working within the confines of a restructured hospital as an employee, I know there are clear hierarchical processes. And even now, I only have experience talking to certain folks within MOH. I know there are incredibly smart and devoted people in the civil service at all levels of seniority. I know passionate and caring people who are active volunteers in various groups, charities, and social enterprises. There's a flourishing ecosystem. But I wonder if there are too many small to medium groups, can we pool these resources? Every one of us may be a domain expert, but we don't know what we don't know. For my participation in the MHIC, I had the privilege of networking across different industries to be acquainted with insurers, financial advisors, actuaries, and to discuss healthcare problems from their point of view. It was humbling to realize how little of healthcare financing I knew before as a clinician. I am yet again bringing up the story of blind men examining the elephant, right? And everyone only touching the part they can touch and arguing about, what the elephant looks like. Because it is true, we don't know what we don't know. I now challenge you to think beyond your usual area and how you can apply your knowledge to better support healthcare wherever you are in. You have heard the problems I brought up as a doctor, as a healthcare leader. Are you able to help me? I respectfully share some of my ideas of how to align future policies with the compass oriented towards healthcare. Formal work groups seem very structured. I believe that when people with similar goals and ideas discuss casually, the mind mapping and synergy may create something way better. Starting from young, ACDA and MOE can work closely with MOH to identify key basic health messages for young Singaporeans to learn. And the challenge is not in rote learning, but how to get updates on information, because some scientific breakthroughs develop rapidly. The food pyramid that I learned in primary school is now outdated, replaced by the healthy plate. And current nutrition and fitness research is leaning towards low-carb diet with resistance training. Who knows what will the future research show? Teach children how to eat right and cultivate the habit of regular exercise to maintain a healthy weight. A lot has been done for mental health education and safe, appropriate use of social media in primary schools. These can also be adopted for adults who did not grow up in the internet age, so that they are also taught about online etiquette and safety. Introduce and strengthen the idea of the family doctor and the importance of good primary care. Teach how to navigate the healthcare system, how to get into subsidized care, and the role of different types of insurance. MSF, in your mission to build strong families, could also collaborate with MOE and MOH to shape sex education, guide families on how to hold the tough conversations on morality, religious belief, and identity. Ask the coaching industry, especially those who specialize in sexuality counseling. Teach older teenagers and tertiary students about the parenthood journey, its many joys but also hardships, so that in time, young couples make an informed decision about marriage and the pros and cons of having children or not, and when to have children, in their 20s, 30s, or 40s. Once we enter the workforce, we often neglect our health to pursue a career. In work with long hours of shifts, we develop unhealthy eating habits and irregular sleeping hours and don't know how to make time to exercise. How many adults notice weight gain and lethargy over 5 or 10 years of working life? The weight creeps up on you. Singaporean men have yearly IPPT to clear, but women might not have a fitness benchmark. There is a phenomenon of being skinny fat, where the person has a healthy weight range but has very low muscle and bone mass. I think this is where all different ministries can contribute to health by continuing education on diet and exercise, screening and vaccinations, as well as empowering adults. For MOM, look into how to develop healthy routines at the workplace. Ask the fitness industry. Make affordable, healthy foods easily accessible. Encourage 10 to 20 minutes of simple office or chair-based exercise. Get the bosses to implement such health practices. Teach workers screen time limits and the value of mental breaks. Look into flexi hours so that they may prioritize time for themselves, family, and medical appointments. Consider incentives for good health. Work with MOH, CASE, MAS to look into alleged complaints of poorly paying corporate insurances and panel limitations imposed by TPAs. Help workers to assess good quality care. Ministries such as MCCY, MSF, MCI might be ideal to be the facilitators of cross-collaborations between different ministries. Good ideas, content, and projects can be supported by all, rather than every ministry trying to come up with their own independent project. I give one example. If you Google Singapore, how to lose weight, see what comes up. Articles on Health Exchange, Health Hub, and HPB gets buried amidst advertorials from aesthetics clinics, spas, and gyms. One good quality article with a good video might be shared across different ministries and across all the different social media platforms for wider reach. Repeat the same essential health messages in each of your various networks. Eat right, exercise every day, protect your mental health, whichever division you're in, for social support, for youth, for sports. I thank the MND for the new skate park at Lakeside Garden. I hope you continue to integrate sports into the community. Are you aware that Singapore's cityscape is acknowledged as a parkour paradise internationally? But practitioners frequently get chased away by residents who think they're vandalizing and they get the police caught to chase them away. I hope for stronger support for the parkour community in Singapore. The MSE mission to supply water and safe food may also extend to more affordable fresh produce, as eating whole food has more health benefits than processed foods. Food safety labels are regulated by the SFA under MSE, but nutrition labeling is by HPB under MOH. I found the 64-page handbook online. I think people still buy a lot of bubble tea, even when graded C or D. What is commendable is the rise of urban farming, supported by state agencies such as SLA, URA, AVA, SFA, and AVS, and the HDB. I hope I didn't miss anyone out. This has benefits such as a start towards food security, and the health benefits of working with nature, learning to grow and eat our own organic foods will be lasting. IT continues to be a huge aspect, a huge challenge in so many aspects. I said in the previous speech, electronic health records are sometimes nothing better than Microsoft Word documents or PDF scanned and stored online. Systems are unwieldy and not instinctive. Vital signs are still keyed in manually. My patient tried to find her operation histology from Health Hub, Healthy 365, and Health Buddy. We can't find it. I don't know how this can be achieved, but can MCI, GovTech, IHIS, and other IT step boards please coordinate and get a good national system up? I envision use SingPass and Health Hub with trigger questions to remind individuals of major health checkpoints: height, weight, health screening, vaccinations, appointments. Medical tourism, a complex international issue. Will MTI look into how this could contribute to increasing healthcare costs locally, but still help Singapore maintain a leading-edge reputation as one of the best places to get good quality care? I'm still deeply bothered by the businesses of medical concierges who collect fees from healthcare providers in exchange for bringing in foreigners for healthcare. Will MTI help MOH to attract Singaporeans to take up essential jobs in healthcare? Look into the development of healthcare workers to recruit, train, and retain experienced workers. Human resource management will be essential, not to manage people as commodities, but to truly build a good working relationship for them so that they feel appreciated and will stay for the long haul. Complex medical conditions are managed by a multidisciplinary care team. I apply a similar concept to our healthcare system problem. Cross-collaborate, engage with healthcare providers. Step outside of your comfort zones across different ministries and industries. Appropriate remuneration for consultancy work may be something to consider and in time build up a network. I am very mindful of costs. And ideally, if we can call upon volunteers, that would be great. But I also realize that runs the risk of the same few big-hearted people being called upon again and again. Set up a think tank whom all the ministries can have access to and call on for brief consultations on global issues, not ad hoc requests to organizations. As I end, let me recap. I've explained why healthcare should be a whole of government concern and not just Ministry of Health. I have listed chronic problems in healthcare. I emphasize the need for education at multiple levels of engagement, and I ask for everyone to cross-collaborate. My old friend told me, don't pretend you want people to be healthy. You docs want more patients, right? Got business. No, Ideally, I want to look after patients who become sick despite their best efforts, not those who have neglected themselves through lack of knowledge, lack of resources, or lack of self-care. Let's work together to bring down the number of preventable illnesses. That is the real cost savings. It is our individual responsibility to keep as fit and healthy as we can, be educated and keep up to date. As a society, to be kind and civic-minded. For those who hoarded medical supplies and tried to profiteer during COVID, shame on you. As a doctor, I look after all patients equally. But when ICU beds are full, who deserves it? The pandemic has made everyone acutely aware of limited resources. Masks, ART kits, oxygen. That's the real facts of life. There are limited resources, and who will be the gatekeeper as to who needs it most? Healthcare workers need the government to help shape these policies, and we need everyone to prioritize health. Don't force us to have to triage and decide who to save. I look forward to a robust debate. Thank you.